Hi everyone, today Aryan and I will be talking about somatic symptoms and proxemics with a Chinese client.
Lily is a 20-year-old Chinese-American woman. She lives with her parents in Southern California and is earning her bachelor's degree. Lily moved with her parents from China to California when she was 18 so she could attend an American university. Ever since she arrived 2 years ago, Lily has found adjusting to American life very difficult. Making friends has been especially challenging. She notices that whenever she tries to talk to new people at school, they seem uncomfortable and try to physically move away from her. Not only do prospective friends seem put off by being close to her, but some have even stopped talking to her after she told them where she is from and what neighborhood she lives in now. Those prospective friends that do seem comfortable being in close proximity to her make jokes about being a smart Asian. Because of this, she has felt overwhelmed with the pressure to have perfect grades.
In the last 6 months, Luli has been increasingly distressed by difficulty sleeping, headaches, and loss of appetite. When Luli expressed her physical ailments to her parents, they suggested she schedule an appointment with a doctor. Following their advice, Luli scheduled a consultation with the health clinic on her college campus. The doctor she met with, a Chinese-American middle-aged female, was unable to find any medical explanations for the symptoms Luli was experiencing. The doctor proceeded to inquire about the presence of any significant stressors in Luli's life recently. Luli explained how her physical problems have been keeping her from completing schoolwork. The physician referred Luli to a counseling center on campus to determine whether there are any psychological factors contributing to her physical symptoms. Luli relayed this information to her parents and was met with confusion and disapproval. Her parents asserted that nothing was wrong with her mind and that she was not crazy.
We want you to consider this vignette with the assumption that Lily does proceed with treatment even though her parents have reservations, sort of as a last result to treat her physical symptoms since her doctor couldn't help. And the first topic that we'll be covering in regard to this vignette is somatic symptoms, specifically with depression. And so somatization refers to the tendency to emphasize somatic symptoms when experiencing a psychiatric disturbance. This tendency has been widely reported in patients from East Asian cultural contexts suffering from depression. Silverstein and Levin found that females exhibit a higher prevalence of somatic depression compared to men. And it was also found that the presence of multiple somatic symptoms within depression implies a higher severity in terms of duration and psychiatric comorbidity. In regard to depression and anxiety, both disorders affect women at rates significantly greater than men, and women have a documented higher frequency of comorbid depression and anxiety disorders. Studies have shown that depressed and anxious individuals are at a higher risk of physical illness as well, and the following symptoms have been found to predict depression in a non-clinical sample, including tension, heart pains, sleep disorder, anorexia, unintentional weight gain, migraines, and sexual disorders. When working with Asian clients particularly, instead of mentioning anxiety or depression, they will more likely mention headaches, fatigue, restlessness, and disturbances in appetite. And then to highlight similarities and symptoms in the presentation of depression and anxiety, I've listed some of the somatic symptoms shared between both disorders and listed below. And then Asian culture and mental health, they hold a holistic view of mind and body. Emotional difficulties are shown through somatic complaints because the mind and body are considered inseparable. It is believed that physical problems cause emotional disturbances and that symptoms will disappear once the physical illness is treated. And then in China specifically, physicians and patients relate internal organs to emotions and carefully attend to bodily sensations. So for example, physicians see the liver as the cause of headaches, epigastric pain, and hypertension and anger, while the heart can be a cause of anxiety, uncertainty, and fear. And then Asian Americans tend to underutilize counseling services, with only 18% of Asian adults utilizing services, compared to 46% of whites, 42% American Indian, 30% of Blacks, and 27% of Hispanic adults. Among traditional Asian groups, seeking psychological help may bring shame and disgrace to the family because of a strong cultural sanction against the disclosure of family problems. There's also a restraint of strong feelings as a basic value that guides behavior. Talking about feelings directly violates cultural norms, and Asian clients may be perceived by a culturally incompetent therapist as uncooperative, guarded, and reserved because of this. There are also hierarchical, patriarchal, and a collectivistic culture. Asian clients will see you as an authority figure and may be reluctant to disclose intimate feelings and concerns. And they might also avoid eye contact when listening or speaking to someone of higher status. So make sure not to mistake this as them being cold or avoidant. They're simply showing you respect. And because Asian culture is collectivistic rather than seeking outside help, they are more likely to handle problems within the family, especially since they don't want personal family matters to be spoken about outside of the family. And then in regard to treatment, Asian Americans prefer more active, directive, logical, rational, and structured forms of helping compared to non-directive ones. And then as a closing note on somatic symptoms, it's important that you do not confuse the presence of somatic symptoms with somatic symptom disorder. Somatic symptoms without an evident medical explanation is not a sufficient reason to make this diagnosis. And then in addition to somatic symptoms, diagnostic criteria requires excessive thoughts, feelings, and behaviors associated with one's symptoms according to criterion B. And then these thoughts can either be disproportionate and persistent, cause a high level of anxiety about health, or an excessive amount of time and energy devoted to symptoms for lasting at least 6 months or more.
So another topic we considered with Lu Li is the topic of proxemics. So proxemics refers to personal space, which is a socially learned construct that allows people to manage interpersonal stress and behave appropriately in their own culture. The amount of space used changes depending on the situation or setting, such as the power distance between two people. Classical proxemic theory has 4 different proxemic distances, which are described in more detail in the handout, but they are intimate distance, personal distance, social distance, and public distance. Gender, age, and social environment are cultural factors that also influence interpersonal distance. And then cultural norms are the primary determinants of interpersonal distance. And first, they're categorized into 2 groups, being contact and non-contact cultures, where contact cultures default to less space between people and more physical contact, while non-contact cultures default to more space between people and less physical contact. So proxemics in Asian cultures are perhaps more specific to our client Lu Li. So in a study with Singaporean Chinese participants, the participants preferred a minimum of 4 to 5 feet between themselves and another person who was a stranger in a public scenario. And this is more similar to the closer proximal distances of personal and social dimensions in American culture. And another study found that individuals of Chinese descent tend to keep closer proximity than Americans. Therefore, China is categorized as a high contact country. In Chinese culture, the invisible personal bubble that we have here in American culture doesn't usually exist, and too much space between people who know each other might actually be considered concerning. Additionally, friends and family should be close enough for physical contact. Furthermore, many areas of China are densely populated, causing people to be close to one another, and this normalizes close proximity in the public distance dimension. Finally, with proxemics, the same study describes China as having a mild climate and unique history, which has led to, quote, Asian people's gentle character. They connect this to a culture of peacefulness and caring that has resulted in high contact proxemics, and collectivism in their culture also is associated with their closer proxemics.
So treatment recommendations, it's important to assess newly immigrated clients' level of acculturation. In Lu Li's case specifically, she has been in the United States for about 2 years, but that's still fairly recent. She may still have trouble acclimating to American culture. It's also important to treat somatic complaints as real problems. Like I said earlier in the presentation, Asian culture views the mind and body as inseparable, so you need to address these together. And then results of a study based on a Chinese inpatients with depression showed that health anxiety may mediate the influence of functional somatic symptoms or illness behavior. So it is important to assess for this. Somatic symptoms of depression are typically treated with pharmacotherapy, such as antidepressants or antipsychotics, and cognitive behavioral therapy. However, motivational support, psychoeducation, coping strategies, social skills training, and family interventions and relaxation techniques are also effective. And then because Chinese individuals hold a holistic view of the mind and body, they may be more receptive to treatments such as meditation, spiritualism, shamanism, and the use of herbs as opposed to medications. So it's important to speak with your client and see which they prefer. And then going on, Bowman et al. Found a strong correlation between depression with many somatic symptoms and suicidal plans and thoughts. Suicidal attempts disruptive behavior as well as multiple stressful relationships. So it's also important to assess for suicidality. And then rather than asking about depression and anxiety directly, ask questions such as, quote, dealing with headaches and dizziness can be quite troublesome. How are these affecting your mood or relationship with others? And then also form a collaborative relationship with the client where you can problem solve and form goals and homework ideas together. And although Asian clients prefer a directive approach and will want you to give advice, it's important to maintain a professional relationship and present advice and suggestions tentatively. Because Asian culture is collectivistic and family-oriented, you may want to utilize the family as a support network and ask questions such as, how does your family see the problem?
So additional treatment recommendations. Many of the studies on cultural proxemic norms produce conflicting evidence, resulting in inconclusive guidelines on the best practices for adapting proxemic behavior to culturally diverse clients. The most conclusive evidence available suggests that a client of Chinese descent may prefer closer interpersonal distances and more physical contact than their American therapist. Americans are sometimes uncomfortable when people of Chinese descent inadvertently invade personal space. So when working with clients like Lu Li, be aware that they may stand or sit closer or use touch more often than Americans might. Furthermore, clinicians should be aware of implicit space-focused racial biases that they hold and how those biases affect their proxemic relationships to clients. Additionally, Chinese culture places high value on harmony, and therapists working with clients of Chinese descent should make compromises between the proxemic preferences of themselves and the clients. Finally, treatment recommendations. Lu Li may have difficulty making friends because she is using closer proximity than her American peers are accustomed to, maybe causing them to feel that Lu Li is invading their physical space. This may be unconsciously perceived as threatening or rude by the peers. Furthermore, racial stereotypes associated with Lu Li's country of origin or new neighborhood may be eliciting implicit or explicit racial biases on some of Lu Li's peers.
Thanks for watching.